The French health authorities reported a record number of new COVID cases on Tuesday. A total of nearly 465,000 cases have been registered for the previous 24-hour period. That sends the 7-day rolling average to more than 300,000 cases per day. Well, the Omicron variant has fast become the dominant variant here, accounting for some 96% of new infections in France. Meanwhile, the German health authorities have today announced more than 100,000 new COVID cases for the first time. 239 deaths from the virus have also been announced there. Well, the World Health Organization is warning that the virus is far from being behind us.
Now is not the time to give up on the strategy. We're hearing a lot of people suggest that Omicron is the last variant, that it's over after this. And that is not the case because this virus is circulating at a very intense level around the world.
Now is not the time to give up and wave the white flag. We can still significantly reduce the impact of the current wave by sharing and using health tools effectively and implementing public health and social measures that we know work.
OK, the World Health Organization giving its verdict there. Well, let's get more now from Alison Pollock, who's a professor of public health at Newcastle University in the United Kingdom. Thank you very much indeed for speaking to us, Professor Pollock. The Pasteur Institute here in France said a few days ago that the peak in France would come in mid-January. I mean, just looking at yesterday's figures, approaching 500,000 cases in a 24-hour period, it makes perhaps Germany's assessment of a mid-February peak sound a bit more realistic, doesn't it?
Well, I wouldn't want to comment on that, but certainly if you look at the UK experience, we've had the Omicron since December, and we've had roughly about 4 million cases in the last week alone. But we've pretty much peaked and the cases are falling. But the important thing to say about these cases is it's a very confusing picture just looking at the cases, because they include people who've got very mild disease and may even have no symptoms at all because of the way in which we're doing mass testing. And a much better indicator is what's actually happening in the hospitals and intensive care. And the picture is very reassuring in the UK in that hospital admissions are not rising in line with the cases. They are rising a bit, but nothing like the cases. And also, our intensive care unit admissions are no higher than the normal pneumonia C averages that normal pneumonias that we've seen in previous years. So we're looking at a highly transmissible virus, but for the time being, it doesn't look as if it's any more virulent. But what we do know is also that if you've had infection in the past, you're less likely to be reinfected, and that reinfection is generally mild. So we're seeing a confusing picture here with reinfections. And the other thing is that the over-optimistic claims for the vaccine, and that's particularly pertinent in France, where your government's brought in vaccine mandates. But actually what we know against the Omicron is the vaccine is far less effective. The vaccines are very ineffective against symptomatic disease at around 20 weeks. The vaccine wanes completely, although there is effectiveness against the booster in the short term. But the vaccines are very short-term measures. Where this virus is going will all depend on how much population immunity you're getting, both from natural infection, but also with the top-up of vaccines, particularly in vulnerable groups.
So this being the case, sorry to interrupt you, Professor, this being the case, I mean, high numbers of vaccinations here in France, very high numbers of cases. We're talking close to 500,000 in a 24-hour period, possibly much more than that, because actually the German health minister said he thought the real number of cases probably double what was being reported, because some people have it so mildly, they're not getting tested at all. But do you think all of that combined together is going to mean that perhaps we'll be out of the woods all the sooner?
Well, I don't have, I don't have the gift of hindsight. But certainly if you look at the UK figures at the moment, it's looking much more optimistic. And certainly we haven't got any evidence that all this mass testing actually stops transmission. And indeed, what we're seeing from the high vaccinations is it's not stopping transmission of the new variants. But what we are very optimistically seeing in the UK is an uncoupling from severe disease, both due to natural immunity and the combination of some of the boosters, especially in vulnerable groups. But we mustn't over-egg the benefits long-term of vaccines. They've been a very good short-term measure, but we'll need to wait and see. But actually, we haven't any evidence for making vaccines mandatory or for mass testing in the way that the government has been doing in the UK, for example.
And don't viruses generally get weaker with the passage of time? And could we perhaps be at that stage where, I mean, we heard before we crossed to you, the World Health Organization saying, don't let your guard down. But at the same time, if the virus is getting weaker and we're not seeing large numbers of hospitalizations in line with those high numbers of cases, we're just going to have to live with the virus and do our best. Doesn't that roughly sum it up for you?
Well, there are two things to note. Is that as you have more and more people infected, you are going to get a lot of population immunity, which will wane over time, but reinfection should be less severe. Because, of course, you're immune, your T cells and B cells are being raised against the whole virus, unlike the vaccines, which is just against the spike protein. But the other point that you've made is a good one. That's our textbook, which is that viruses like to survive in the population, so they become more transmissible and less virulent. That's what our textbooks say, but we'll have to wait and see with this one. But there are notes for cautious optimism. But that doesn't mean to say we stop all public health measures. Hygiene, sanitation, good ventilation is really important, but so also is addressing the main determinants of bad outcomes. And for COVID, those main determinants, those main risk factors are poverty, associated disease with comorbidities like diabetes and asthma combined with poverty, and also obesity. So these are really important. But poverty is the main one if a government is determined to address future outbreaks and future pandemics. And that's in the hands of the government. So it can do a lot to alter the environmental factors, which makes this virus so virulent for some groups. It also needs to build up public health and social care in a way that it hasn't been doing. So there are things, very important public health measures that we know work, but we should be stopping the measures that don't work, like masking school children, like mass testing, like school closures. All of these were short-term measures and they really should be stopped. And we also need to look at repeat vaccination, that we only boost people who are really susceptible and vulnerable because we do not have the good long-term trials data on the long-term harms of boosting and repeat vaccines.
OK, well, thank you very much indeed. We're going to have to leave it there. Professor Alison Pollock, thank you so much for speaking to France 24.